We welcome you to another episode of Learning Stories. This is a show where we profile a diverse set of learners from the 21st century. In each episode of this show, we interview a guest who has a story to share about how they acquired a set of skills and knowledge in a creative and innovative manner. In the process, we hope to uncover a new understanding of learning as conceptualized, narrated, and imagined by the guest in our show. Today's guest, Priscilla Matthews, is someone who's always inspired me for her passion for her chosen profession. We got to briefly meet when I was a student at Western University, and she was so kind. She was my peer guide, and she helped me as an international student. But I got to know such an inspiring person, but also a student that's really passionate about the medical profession in general. Just a little background about Priscilla before we jump into the conversation. She's a third year medical student at McMaster University. Before medical school, she completed her Bachelor of Medical Sciences and Masters of Management of Applied Sciences at Western University. So, Priscilla, I've always been curious about what early experiences shape your thinking with regards to your profession. So if you had to look back at your life and think about um, when that seed of thought really came into your head about being a medical professional, what would that moment be for you? And what was Priscilla like as a child? Growing up beyond that.
Okay. Um, when I think about kind of where everything started, I really have to say it was my mom. So my mom is actually a doctor, and I just saw how hard she worked and how much fulfillment she got out of her career, and I think that really inspired me as a child. So just to give some more context, my family came to Canada in 2001, and my mom was an international medical graduate, an IMG as we call it. So she got her training done in India. And then coming here, she had to redo all her certifications and requalify as a medical professional, which was extremely difficult, especially with two young children. And in a place that has new cultural norms where you have no family and no friends, but seeing how hard she worked um, to sustain her career, but also be a good mother and be there for the family was really, really inspiring to me. And I kind of wanted that life for myself. I wanted to be someone that worked really hard. And in terms of what actually specifically drew me to medicine itself, this question's always so difficult, but I really just think it was just the gratification that comes with helping people and being there for people in such vulnerable times. Um, there was a time when I was young, and I have asthma, so I had an asthma exacerbation, and I just remember like finding it very difficult to breathe. And then this doctor came in and gave me, my the right medications, and um, just having like I remember just feeling really blessed and touched to have someone take care of me and explain what was going on, like to my parents, to the family, be very supportive. And I saw myself in that role in my future. So um, that's one of many experiences, but yeah, just the joy and fulfillment that you feel when providing help to others, I think.
Yeah, that's amazing, Priscilla. And I think that that feeling of wanting to give back, I think that's such a powerful driver, to keep you going in the difficult times. But um, what about school, Priscilla? Like I recently finished a unit with my grade 5 group about the human body, where every week we'd learn about a different organ system, we learn about different ways it could malfunction.
Mhm.
So I mean, what were your early memories of, I don't know, biology or maybe even other subjects? Were there other subjects you were interested in? Because I know you are really interested in art. And, I'm thinking about the Priscilla beyond medical school. What were you like at school? And, you know, yeah.
Yeah. You know, I think I was always someone that was very, uh, the one word that comes to me when I think of my childhood was very shy. I used to
Mhm.
be very shy, very quiet. Still am a little on the quieter side, but but uh yeah, that's the one word that comes to me. But I still did have that curiosity to learn. And I think even though I was one of the quieter students, I was always thinking, always like wanting to know more. Um, I loved biology as a student. I loved learning about the human body and like how different things worked, um, and understanding like where things could go wrong. It was really interesting to me. Um, and yeah, I think another really important part of my identity at that time and also now is the creative side. Um, as a child, I used to love doing artwork. I was actually in my middle school years, I was enrolled in a school that had an arts program. So I think that was great because it showed me that art is so valuable and that it's so creative and you can like it's important. It's important not to neglect that side of myself. And I think it was good that I paid attention to that at that time because even now I still am attached to that artistic side of myself. And um, I I don't know if you know, but I have like a small business where I make like custom cards, and I'm really proud of it because I started it all by myself, and I really enjoy it, and people have left good reviews. So, um, yeah, I would say quiet but curious and creative. 3 C's.
That's amazing. It seems like you've done this before, describe or talk about. But then I did see the Etsy store. I think it's amazing. You've had some really nice designs there, and I think I was looking at some of the. I think it's so. I think you bring out a real part of yourself through your designs. And I noticed that, and hopefully I'll get one of the cards. I really liked some of them, and the reviews were also nice. But I think it's so nice that you're able to balance, being a medical student and this side business at the same time. And for the viewers listening, I will put a link to Priscilla's Etsy store. It's called CillaCreates. I think it's amazing. I really enjoyed looking through it. But yeah, Priscilla, what was, and even the point you mentioned earlier about going through a medical illness yourself, I completely relate to that because like a couple of years ago, my father, he got a stroke, and it was just so powerful to see and so inspiring to see how medical professionals, doctors were there for him at the right time. And uh, and even my mom has asthma, and I had it for some time. And I think the role doctors play, the importance of the role doctors and medical professionals and even nurses and everyone in that establishment, I think it's so important for society. And especially with the pandemic, I think we've just started appreciating, the importance of that role in society. But Priscilla, like after school, I know you decided to apply to Western and a couple of other universities. But what was your experience at Western like, and what were you sure you wanted to get into medical school at that point of time? And what were some of your other experiences at Western that you really remember fondly?
Mhm. So Western was great. I was in the medical sciences program, and I enrolled in that program because I did know that I wanted to do medicine. Like I said, I've kind of had the idea since childhood. I was lucky in that sense where I kind of like knew what I wanted to do. I know a lot of people have like confusion, which is okay and it's good to explore. But for me, I kind of like knew that I wanted to do it. Um, Western was great. I think it was like, as I mentioned, I was kind of on the quieter side, shyer side. And I think Western really opened up that opportunity for me to be more outgoing, kind of move past that shyness a little bit, learn how to advocate for myself. And not just in my undergrad, but also my master's. I think the master's is where a lot of my self-development came, because yeah, I like I was like very independent at that time. And I grew as a communicator, I grew as a time manager. And I think one of the biggest things I have Western kind of taught me was how to advocate for myself. Because I was kind of that person that let people walk over me. Like if someone was talking rudely to me, like I would just let it happen and not stand up for myself. Or if think situations like that. But being on my own, not having my parents there, and realizing that like I have to seek my own opportunities, I learned that like, no, I can't let people disrespect me. And I have to stand up for myself. So that's the biggest thing I would say I learned during those years, and I'm still kind of growing that skill even now. So yeah.
That's amazing, Priscilla. I think, and and thank you for the time, where you volunteered to be a peer guide. It was really helpful, and the advice you gave me at that point was helpful as an international student. It's always nice to see a sense of community over there, and I think volunteering is something you are also very passionate about, in addition to your other projects. But then you decided to apply to medical school, and for students listening to this, what was that process like for you, and when do you normally apply for medical school here in Canada, and how does that happen?
Yeah, so medical school admissions is a whole thing on its own, but essentially what the process looks like is um, people usually apply in their third or fourth year, and there's a few things you have to complete. So you have to write the MCAT, which is the medical college admission test. And then they look at the score that you get on that. They look at your GPA in university. Um, and they look at reference letters, and then they also will look at your ABS, or autobiographical sketch, which is kind of a summary of the activities that you've done, the extracurricular activities you've done, and research and volunteering and all that. So as you know, I did apply in my fourth year, which is when most people apply. Didn't get in. That was probably the biggest like setback I've ever gone through in my life, and it was very devastating for me because I was put on the wait list and almost got in. And I also watched a lot of my friends who were also on the wait list get in slowly, but I was one of the only ones that didn't. So a very painful experience for me. But then I did the master's, and like I said earlier, that's where a lot of my self-development and growth happened. And then I applied again, and now I'm here. So yeah, that's kind of what that process looked like.
That's Yeah. Uh, you talk about it in very humbly, Priscilla, but I'm sure it's not as easy. I think it's a very competitive process, here in
Yeah.
Canada, at least what I know of it, and I know a lot of people apply, and I know you did apply to a couple of universities, and you are currently a third year medical student at McMaster, which is one of the more esteemed medical programs in the country. But Priscilla, I was just reading this statistic. I was just preparing for the interview, and I was looking at some stats related to medicine. And I think it was in a book by another physician whose name was Atul Gawande. And
Okay. Yeah.
he said that there are over 4,000 different medical and surgical procedures and over 6,000 drugs. And I was so fascinated by that number. I may be wrong in terms of the exact number, but this was just a quote from, I think, one of his books. And then I was doing some additional research that there are 9 organ systems and maybe 47 different possible specializations. So like, what do you? There are so many numbers to play with over there, but Once you enter medical school, I'm sure all of this is, thrown at you. Like what is the structure of medical school like, and how do you eventually decide, or h- because of the different specializations, how do you move from a new student entering medical school to being a specialized or a primary care doctor at the end of that period?
Mhm. Yeah, so it's true. There's like many different types of specialties, and it's grown over the years because now there's the opportunity to subspecialize. Like for example, if you become a pediatrician, you can become a pediatric gastroenterologist, which is like a, a doctor who focuses on gut issues in the child population. So very specialized, and you can even specialize further. Like you can focus on like IBD, inflammatory bowel disease. So yeah, lots of opportunities to like subspecialize. Um, so yeah, I mean, it is kind of a challenge to figure out what path you specifically want to go on. Um, I think the way medical school works is the first half of it is course-based learning. At McMaster, we have we call it problem-based learning, where essentially we take cases, like patient cases, and kind of um, um, facilitate our learning based on that case. So learning around cases, which is actually very valuable because you learn to recognize what's clinically important, because there's so much information you can learn about specific conditions, but you learn to like recognize like, okay, what do I actually need to know when I'm caring for this patient. Um, so that's kind of the first half of medical school. And then also towards the end of that first half, we get the opportunity to go and kind of do what we call electives. So we choose certain specialties that we think we're interested in. So, throughout your course-based learning, you'll like, for me, one of my interests was gastroenterology. I like the gut and the gastrointestinal, the gut issues. So one of the electives I did towards the end was gastroenterology elective, just to further explore my interest and see if I truly do like that. So you get a few of those elective opportunities to explore what you're interested in. And then you enter the second half of medical school, which is called clerkship. And in clerkship, which I'm in right now, you rotate through different electives. So you'll do like pediatrics, you'll do internal medicine, you'll do family medicine, surgery, and you kind of get a taste of each and every one and learn about what the lifestyle is going to look like, what the schedule is going to look like, what the actual job consists of. And that really helps to shape the path that you choose. So it's a combination of like taking interest in the early part of medical school, but then actually seeing how how people in that specialty practice and what their lifestyle looks like. And then I think based on all those factors, you kind of make a decision. Um, yeah.
Yeah, and is that the specialization you want to focus on right now, Priscilla, or you're still, exploring and discovering possible other areas?
So like gastroenterology is,
Yeah.
yeah, I am interested in that, but that is actually a subspecialization of internal medicine.
Okay.
So just like how I described for pediatrics, like essentially what you do is you first become a pediatrician,
Got it.
and then you specialize in gut diseases for kids. So in the same way, I don't want to do pediatrics, but I would like to do internal medicine, which is like adult medicine.
Hmm.
And then I would do 3 years of that, and then go into maybe a gastroenterology fellowship, which is another 2 years after my 3 years.
Oh,
I
wow.
don't know if that makes sense, but
No, it does, because I was trying to understand the structure of medical professionals, and I know there are primary care physicians and specialists. So
yes.
would internal medicine be in the primary care aspect, or would it be a specialist in that sense?
I think in the States, internal medicine is viewed as primary care, but here an internist is like a specialist.
Got it.
Or To be honest, I'm not, I need to like figure this out, but like a gastroenterologist, like if you do the 2-year fellowship after your 3 years of basic internal medicine,
Yeah.
you are a specialist. Yeah, something
Yeah.
along those lines. I think family doctors are what is called like a primary care physician.
Okay. Okay. So yeah, and that's a lot of school, right? And after your master's, you are as medical professionals, you are in school for some time, and I think
Yeah. But the good thing is, like, I mean, I was in school for 1.5 years, but I feel like I'm kind of like working now, like because I go to the clinic every day. I actually see my own patients, and then obviously I review with the doctor, but like I'm kind of like I'm basically functioning as like in the clinical setting. It's not like book studying anymore. I mean, of course you have to read a little bit, but um that's a good thing. And when you start residency, it's not like book studying. It's you actually get paid and you have your own patients to look after and stuff. So um, that's a good thing that, it's not like you'll be studying from books for the whole journey. Yeah.
and is that something you enjoy? Because I remember listening to one of your other interviews, Priscilla, and you said that one of the things you really enjoy about, being a, I mean, hopefully being a medical professional, but being a student is that patient interaction piece. And I
Mhm.
think the way doctors speak to their patients or can really affect the eventual well-being or the eventual outcome. So is that something you really enjoy, the patient conversations?
Yeah, for sure. I mean, I'm still very early in my journey, and like I've had some very impactful patient experiences. And even, when you try a little, like when you go just the extra mile for a patient who you see is struggling, like even just explaining to them what exactly their condition is, because a lot of times we're so caught up in trying to like manage the patient and give them the right treatment that we forget to like sometimes fully explain what's even going on to them, and they're confused, or their family members are confused. So even doing simple things like that makes all the difference for them. And I've had a f- I've had a few people say like, thank you so much, like I can tell that you care. And that means so much to me that like someone else is able to see that, because I do care about these people, and I want the best for all the patients that I've seen. So um, when they see that in me, it really it really does fill my heart and makes me more motivated to like be a good doctor, be a kind doctor, be an empathetic doctor, and just remember that they're people at the end of the day. They're not just like another number or another patient, but they're people, and they deserve like respect and all of that. So yeah.
That's really powerful, Priscilla. And I remember I think it was the same physician, Atul Gawande, and I really enjoy reading memoirs by doctors. And in one of his books, I think it was Being Mortal. You probably um, heard about it somewhere, but he mentioned that um, in I think it's palliative care, which is care at the end of your life, and he spoke about how sometimes at the end of an individual's life, rather than wanting to live more, the person may have this decision where they actually want to lead a comfortable life around their loved ones, and
Mhm.
the only way to actually know that is to have a conversation with them about what their priorities are at that point in their life. And I actually used some of those principles in conversations with loved ones in my family, and I think there's this delicate balance of empathy and professionalism that you have to tread as a medical professional, and like apart from like the actual medical practice and the technical skills, Priscilla, what are some of the other skills you think doctors need to develop and as as professionals, according to you?
Yeah, that's a great question. I honestly think medicine is it's definitely the knowledge, but it's also very much an art, right? Being able to talk to people, being able to empathize with people. So yeah, empathy is a huge skill that you need in medicine. You'll see people that are really suffering, And yeah, like you said, you have to balance empathy and, kind of stepping in their shoes with being professional and keeping your distance so that it doesn't affect you and you're not carrying those burdens with you. I think communication is very important. One of the big things about medicine is breaking bad news, telling someone they have cancer or a life-limiting condition. And you have to be able to do that in a very sensitive way, but also in a sensitive way, but also in an honest way, right? That's another big thing. Collaboration is very important. Learning to work well with your team members, because medicine is a team sport. Nurses are so important, physician assistants. There's many people that are part of the team, and when everyone respects each other and works well together, there's better patient outcomes. I think another thing is hard work. You must be hardworking to be in medicine. There's so much studying and so many exams that we have to write, and it's a lifelong learning career. There's always like updates to the guidelines for how to manage a certain condition, and you have to keep up with those things and then use them in your practice. So I think medicine is one of those things that you really have to enjoy to like be happy in, because it is a lot of hard work, and it takes a lot out of you as a person. And I mean, for me, it's like part of my identity too. Like I can't really separate my career completely from my personal life, because I'm so involved with medicine and I enjoy it a lot that like it is part of who I am as a person, if that makes sense.
Yep. And do you think that you find it hard to find that balance sometimes? Because as a teacher, I think one of the challenges of our profession is that we take a lot of our work, and I think in teaching it's more the emotional burden, where you are, working with a lot of students, and each student comes with their own, and eventually there's an emotional toll on your but then sometimes you tend to bring that home, and that, I mean, it is hard to set those boundaries. But do you feel like, as a medical professional, just to is there a need to set those boundaries between your personal and professional life?
Definitely. Like you said, like for teachers and for many other professionals, like it's very easy to take those burdens home with you.
Yeah.
And I think it's very important to like set boundaries, and even just to prevent burnout, right? Like, because if you're always taking work home with you, you like the lines get very blurry between personal and professional life. So yeah, I think, and especially at Mac, where we have a 3-year program and I mean, normally the other schools get 8 weeks of summer vacation. We only get 2, right? So you really have to like learn how to kind of find that balance in your everyday life. And I think I have found that, although I mean, most of most medical students have like the type A personality where we're always like working really hard and stuff. But I do think I've found like a happy balance for myself. It could be better, but um, I try to enjoy, and that's another thing I think I've learned throughout the process, is like learning to really know where to put your energy, right? Because it's just impossible to put your full energy into every single thing.
Mm.
You have to like realize like, okay, what needs more energy and what needs a little less energy. um, so I think I've like kind of, I'm finding that balance. And yeah, like doing the CillaCreates thing, for example, like my art stuff has really helped kind of, it's helped me prioritize interests outside of medicine, right? Because that's now I actually have other responsibilities, like to do people's orders and stuff. So yeah, I think it's good to have like involvement in other things as well.
Yeah, and I think that's something that's applicable across professions, right, Priscilla?
Yeah.
It's not just not just medicine for that respect. Like, are there any doctors or medical researchers that really inspired you? I read the paper that you had published on the COVID pandemic and how it's not a one size fit all for everyone. I think, was this during your time at Western, Priscilla, or was it more recent?
It was more recent. It was kind of it was just after I graduated from Western, or finished the master's. I was doing like a summer internship somewhere at a public health consulting agency.
Yeah.
And so yeah, it was a time when, the COVID pandemic was still kind of new, and lockdowns were being enforced. And um, it's interesting because yes, lockdowns are definitely very, very effective, and I think they were necessary to kind of limit the spread. But that paper just provided a different perspective about some of the unintended consequences of lockdowns, and things that should be addressed if we are enforcing lockdowns. It's specifically from like a global perspective. I think that paper compared like the global south versus north countries. So it was nice to work on that. And then I think you asked about a medical professional that inspires me.
Yeah.
So there's actually there was this cardiac surgeon who used to work in Hamilton, and she's actually in the newspapers. I forget her name. I should know this, but um, she was I believe she was fired without a proper explanation, and she just so happened to be the only female among the team of cardiac surgeons. And it was interesting because she didn't just let, like, she was fired, but then she didn't stop there. She actually went and pursued law school, and kind of found the legalities of kind of looked into the legalities of her situation, and sued uh, sued the medical program,
Bold. Yeah.
yeah, the employer. And I just found that really inspiring as a woman, and a woman of color who, um, you know, we face our own unique intersectional barriers. It was really inspiring to see that, because it just motivated me that, like, I need to advocate for myself, as I mentioned earlier. Like,
Mhm.
you can't let people walk over you, or like ruin your career, or try to like bring you down. Like, it's so important to try to advocate. I don't know if I'd pursue a law degree, but um yeah, I think that I found that really, really inspiring, that like she didn't let those people just walk over her. She decided to like take a stand, and seek justice for herself.
Yep, and I think that's such an amazing story, right? I think just standing up for yourself, and I think you also mentioned an important point, Priscilla, about that our intersectional identities, in terms of our gender, our sexuality, our so I mean, do you see some of these coming into play as you are defining your identity as a medical professional? For instance, what is it like being a person of color, being um, do you feel like certain specializations have a gender disparity, or what are your thoughts on that topic?
Yeah, so definitely some of the specialties have more men than women, like actually a bunch of them. And then there's a few that have more women than men, for example, obstetrics and gynecology. Um, but yeah, I think it kind of, so luckily I haven't actually faced um, any mistreatment or anything based on my race or the fact that I'm a woman. Um, but like, I know that at some point I probably will, because those biases are ingrained in people. Um, but I think I really do know my worth, and I know that I'm qualified to be here, and like, we're all equal. We're all equal in this, right? So uh
And yeah, I think nothing like medicine to actually prove that, right? At the end of the day, I mean, all of us get sick, and all of us, no matter where we come from, no matter where we live, we will face one ailment or another at some point of time. And
Exactly.
I think your gender, the color of your skin, or your background doesn't really matter. I think like the kind of care you receive is the most important at that point, right?
Yeah, yeah, definitely. Um, and like honestly, I think being this kind of goes back to, Eurocentric standards and all that were very much ingrained in societal norms when I was younger. Like I was kind of, I hate saying this, but I feel like I was kind of embarrassed to be like Desi, like Indian.
Yeah.
And, I was always like, why is my skin darker than all these other people? And like, why is my hair so like fluffy? And um, why do I have more like hair on my body, like compared to these other people, right? Um, and really caught like I was like being Indian and the features of Desis, like thicker hair and whatnot, like used to be some of my biggest insecurities. But honestly, now I'm like so proud to be Desi. Like um and yeah, I'm happy. I'm just like, wow, like and whenever I see like other people of color as well, I'm just like, you go, you go, girl, or you go, whoever you are, because um, we have faced so many barriers, and for women especially, there's like the additional barrier of like um, gender, um, and so being able to fight those barriers and land up where you are and being confident in that is a huge accomplishment. So yeah, I'm very proud to have this ethnic background.
No, I totally relate to that, Priscilla. Because early on in my teaching career, I have an undergraduate degree in literature, and my training was in high school English. And very
Mhm.
often I would go into schools as a brown person teaching English. And because of the way the colonial structure worked, certain kinds of language, I mean, like an English spoken in a particular way is placed in a pedestal in comparison to an English spoken in another way.
Yes.
So, and I did feel that, and it's more, um I think it's more the microaggressions, that you notice more than like explicit behavior. And I think it's also representation in terms of seeing other people around you with the same background. And I think, yeah, and I think, and you somehow realize that in addition to being a profession, there are also social challenges, like in relation to class, gender, race, sexuality, that each profession is trying to navigate. And I think those conversations um, need to be dealt with by medical professionals or any other professional on a day-to-day basis, right?
Mhm.
Like in on a policy level, Priscilla, are you like interested in healthcare around the world? Because I know in Canada, for instance, it's very different than India, or maybe Australia or the US. Because my sister stays in the US, and the other day I had to go pick up something because I went to visit her recently. And I went to the store, and I think my dad had diabetes, and I wanted to get him like a medicine. And I think uh, the drug didn't cost much, but the tool that administered the drug was so expensive. And he didn't have an insurance because he was like an international traveler. So it was just interesting to see how different countries, especially countries that are right next to each other, can have such different policies. Even here in Canada, for instance, I remember a friend telling me that she decided to go to India to take up a medical treatment because she had to wait for about 6 months to a year and didn't hear back for that particular treatment. And she told me that the priority over here is given to the intensity of the case rather than. And I know that, so like how do you process some of these things as a professional?
Yeah, so it's challenging because that is true that, higher priority things or more emergent procedures or conditions need to be taken care of first. Uh, like, if there's something like that needs urgent surgery, that person will likely get surgery first compared to someone else who can maybe wait a few days to get a surgical procedure done. Um, So that's kind of the system we have. And unfortunately, it does. And with the pandemic, it caused significant wait times. It's very difficult now for people to even find family doctors, which is insane, right? Because family doctors kind of manage all your issues. Um, so, yes, I think there's definitely some disparities and cracks in our healthcare system. But then you look at places like the US where people cannot get healthcare because nothing is covered by the government, right? So it's one of those things that, there are a lot of improvements we need to make, and lots of things need to be addressed. And I think slowly some of them are being addressed. However, I think I'm also grateful to be in a place that has a basic level of healthcare for everyone, because I don't have to worry about myself or my parents getting sick and having to pay like millions of dollars or thousands of dollars in care. Um, yeah, so that's definitely a very important thought as a
Yeah.
healthcare professional.
Yeah.
Um, and yeah, I think so. You asked, am I interested in like the global aspect of medicine?
Yeah, because
So,
I mean, the reason I also asked that, Priscilla, is because I grew up in the Middle East in Bahrain, and then I was in India and Mumbai for about 6 to 7 years, and then I come here to Canada, and my experience of the medical system in each of these countries was so different.
Mhm,
And I think in India, there is an option of the private system and the public system, which creates a class disparity, because people that have the money are able to access private services much quicker, which you don't see as much here in Canada. But then you have the benefit of accessing medical services really quickly. In Bahrain, on the other hand, it was a much smaller country with around like 1 million people, and it was again similar to Canada, but it also had private options. So like I'm curious, did you see any other country or any other medical practices around the world that you think are inspiring models to learn from? And I know because your master's was also with a focus on certain countries in Africa, so in that research, did you find any stories that you'd like to maybe talk about?
so unfortunately, I have not experienced healthcare in any different countries. During the master's, I was actually supposed to go to Uganda and was hoping to work at like I think a cancer clinic there, because oncology is another one of my interests. Um, but because of the pandemic, I didn't get to go, and it's been a dream of mine to go and do um, like maybe an elective or provide healthcare like abroad somewhere, just to learn about their healthcare system, and also to um, learn like the cultural factors that influence healthcare there, and see what how it contrasts with Canadian healthcare. Um, so maybe in the future, if I get the opportunity to, I would do an international elective, and I think that would be really nice. Um, but yeah, unfortunately, I have not had that experience. But being someone with a global health background, I have always also been interested in kind of like public health issues and um, global health issues. Um, it was something I was more interested in my earlier days of medicine. Now, to be honest, I haven't spent much time thinking about it, but I think I think I would definitely consider exploring, like maybe working in the UN one day, or you know, maybe there's a there's a there's like I think there's like a group called Doctors Without Borders, I
Hmm.
believe.
Yeah.
So maybe volunteering with them one day just to get that international experience that I've always wanted, and to see how like my background in global health kind of plays into my career now as like a aspiring physician. So yeah, I think that's where I see that going.
That's amazing. I think you do really, really well as a medical researcher, and I think just as someone in the policy space too, Priscilla, because the way you speak about health issues, and I read your paper as well. I think that would be really interesting to see your career go down that line. But I understand. I think just the demands of being a doctor on a day-to-day basis are so high that it's hard to sometimes go beyond that daily expectation. But that would be really inspiring if sometime down the line we get to see you write a couple of books about your thoughts and some of these issues, if that ever does happen. Like, and I think that's a nice positive note. I have this question I wanted to ask you, Priscilla. I've just been experimenting with this question, but um, if you could have like a gigantic billboard anywhere, or let's just say like one of the um, I don't know, around Eaton Center or one of those places, and it had like a slogan on it. What would it say and why? And this was like a slogan with like maybe a few lines or a statement that you would want to share with other people based on your own life experience.
Hmm, that's a good one. Um,
And it doesn't have to. It can change over time. But like, what do you think it would be like now?
yeah. Um,
Like just to get you thinking, when someone asked me this question, my answer was be kind, because you never really know what someone's going through, and sometimes like a kind gesture can go a really long way to change or impact someone's day. And that was like my answer to that.
yeah, I there's one that's coming to my mind, but I just forgot the wording. I'm just looking it up right now.
Sounds good.
Um,
Yeah, sounds good.
um, what is it? Okay. So I really like this quote: shoot for the moon, even if you miss it, you'll land among the stars. Um, so I've always been the type of person that kind of doubts myself. I'm just like, oh, like I can't do it. I can't. It actually goes back to like my younger days. Like I said, very shy, had a lot of like self-doubt. When I was in my teenage years, I was training to become a lifeguard, and I failed the lifeguarding course like once or twice. And both times I had a very negative outlook on it. I was like, oh, I can't do it. I can't do it. It was my parents that pushed me, and they were like, just try again. It's fine. And then, like it's easy for us to get into a negative mind of thinking, and like especially when we go through a failure, to think like, oh, I can't do it, or it's not going to work out for me. And I think I've noticed that pattern of thinking in myself a few times, but I've actively been trying to change that, and I actually see myself changing that thought pattern and actually getting more opportunities, because I am starting to believe in myself as a person, as a learner, and as a future doctor. So I really do think that like a lot of people limit themselves and don't try for things because they just feel like they're not qualified, or they feel that it's out of their reach, or everyone else in that position is way more successful than them in some capacity. But honestly, shoot for the moon, and if you don't land on the moon, you'll land among the stars.
Yeah.
um because like, for example, if I let that opportunity of not getting into medical school stop me, I literally would not be where I am today. And some people do. Some people kind of, unfortunately, like, I mean, everyone has different circumstances, but it's unfortunate that they give up on themselves because it didn't work out one time. And even now, like gastroenterology, which is what I'm interested in, is actually one of the more competitive subspecialties within internal medicine. And if you asked me a few months ago, I was actually kind of giving up on the idea of even pursuing it. But now I'm like, no, like why can't I pursue it? Even though it's very competitive. I I can like I can do it. I can do it. Like there's no reason why I should not get it. If I work hard, if I show the enthusiasm, if I put my full effort into it, and if I have, if I'm intentional with it, why not? And if I don't get that, then I'll get something else, which will be good. And, I think everything happens for a reason. So I'm just, it's a quote that I'm living by, and I'm still learning to live by that. And I think a lot of other people can really benefit from believing in themselves and like really aiming high for themselves and not letting like um, failures or setbacks get in their way of accomplishing their goals. So that would be my quote.
That's amazing. Like if I mean if in the short time that I've known you, Priscilla, that if there's anything that I know about you, I think it's your I think what I've always learned from you is your ability to persevere through challenges. And whether it was the lifeguard experience or your first application to medical school, I think you've only come out of both those experiences stronger as a person, and that's really inspiring to see. And I think for anyone listening to this, I think it's just that important of believing in yourself, and just asking yourself why not you is so important, because if you do put in the hard work, I think anything is really possible. On that note, Priscilla, thank you so much for your time. This was really inspiring. Hopefully we get to chat again, and I think it's only going to get busier for you as a medical professional with your, I don't know, residency or your next adventure starting. But
Yep.
this was great. And for the listeners, I will be putting a link to Priscilla's art store. Is it CillaCreates?
CillaCreates, like
CillaCreate.
Priscilla
I
create.
know, I'm sorry, I thought it was Celia Creates, but
That's okay.
CillaCreates.
That's
and
okay.
and
Yeah.
there are also two other talks that Priscilla did related to applying to medical school that I will also link in the show notes. And yep, and until then, do keep stay tuned for more such episodes from the podcast, and keep learning.
Thank you.